Hi, how are you?
Good, thanks. I was wondering if I could get a flu shot today?
Yeah, sure, we offer flu shots. Hey, Laura, can you give a flu shot?
Sure. I'll just have you come over here and take a seat.
Great.
All right. So I'm actually just going to have you fill this out. It's going to ask you some questions about allergies, if you have any allergies to eggs, if you don't feel well today, if you've ever gotten the flu shot before. So I'm going to give this to you. Okay, so it's just going to be a little pinch, okay? All set. Okay, you're all set, so I'm just gonna have you hang out here for a couple of minutes while I run this through.
Great.
This is not just a pharmacy, it's a classroom. Welcome to the Pharmacy program at Massachusetts College of Pharmacy and Health Sciences.
How did it go today?
Good. Went pretty well, yeah.
Excellent. I was watching from over in the corner there, and the observation looked excellent. How about yourself, Christine?
But I made a parenteral solution today, and I worked on my aseptic technique as well, so it went pretty well. A PharmD is a Doctor of Pharmacy degree. It's a 6-year program, and you come out with your doctorate. So when I do graduate, you can call me Dr. Gillis, technically, which is very cool.
So it's different from a medical doctor. Basically, our responsibility is more with the drug side of things, whereas a medical doctor is more like diagnosis type things. But we are the experts in drugs.
I have to say your shot and technique was right on point.
Thank you.
Nice job, Laura.
Thank
I want them to feel comfortable. And our goal is to get these students to be comfortable with these applications. How do I walk out of these doors at the end of this semester, or at the end of the year, and how do I apply that onto my practice in the advanced therapeutic rotations?
Well, I didn't know that I wanted to be a pharmacist all along. It wasn't something that I had in mind when I was a child, but I love the pharmacy profession. Being a pharmacist isn't just standing behind the counter. There's so many other aspects to it and so many different career paths that you can take. My sister went here for nursing, and she graduated 3 years ago. And it was my mom who discovered MCPHS. And so we came on a tour, and I fell in love with it. I thought all the labs were really cool, and I sat down, thought all about it, and started actually shadowing a pharmacist. I just knew it was for me.
So I'm in the honors program, and this is the very first year that our school actually has an honors program. So I'm very happy to be into that. There's about probably 50 people applied, and they only took about 10 people. My parents were pretty excited when I got in.
The honors program is for highly motivated, academically talented students that are looking for an opportunity to go beyond what they're doing in the PharmD program.
There is a lot of homework. It's a lot of material they throw at you. People record the lectures and stuff like that, and they have to go back and listen to it because you can't write everything down. You have to make sure that you prioritize your time accordingly in order to make sure you learn everything. You don't want to procrastinate, wait till the last minute, and then try to study. Otherwise, you obviously won't understand it. I'm a 4th-year PharmD student.
I'm a 5th-year PharmD student.
I'm taking organic chemistry, pathophysiology, biochemistry,
General chemistry,
pharmaceutics,
medicinal chemistry,
pharmacology,
biology,
biotech,
evolution of the healthcare professions, interpersonal communications.
The 6th year is basically the pinnacle of your pharmacy student career. So basically, you're done with classes, you're done with exams, so you're going into different settings in the pharmacy field. But I was driving to rotation the other day, and I was just like, this is what I'm going to do, and I was so excited about it because it was fun. The day is actually fun. Now that it's not just test taking and worrying about knowing everything, now I know it, and now I'm just putting it into practice and interacting with people, and I just can't believe that I'm going to get paid for that.
I've been working in the hospital now for about 3 years, and I've been on a few codes with some pharmacists, and because they try to get me to experience the full aspect of what a hospital pharmacist does. I've been on a few codes where people actually, their blood pressure's dropped, their heart rate's gone, or you inject them with epinephrine, try to get their heart rate going again and everything, and they actually come back to life. It's a remarkable feeling.
Pharmacy, where we're going now is we're really working on integrating our students and getting them to work together as teams. So because where healthcare is going is more of a team-based model, and where we're really going and where pharmacy is going is pharmacists working as really the disease and drug experts and utilizing that knowledge, not just dispensers of medication, but dispensers of information as well as preventative measures.
That's what I love about the pharmacy profession. It's not stagnant, it's always changing, and just by doing the PharmD program, I will be able to, take those different paths in life.
Our goal is our students. They're the product of our program, and our job as faculty within this program is to give them a certain comfort and competence level when they go on to advanced rotations.
Teachers' doors are always open. You can always go and ask them a question during their office hours, and it makes that more one-on-one interaction that a lot of people want, and it helps them learn the material more.
There's not one faculty professor that I've met who has ever, shot me down when I wanted to ask a question or wasn't willing to help me.
Some of my professors are becoming family members to me. A lot of these professors really dedicate their life to the profession of pharmacy, so it's inspiring to be with people who are so passionate about what they do, because then it makes you feel more passionate about what you're going to do, and it inspires you to be even better. They're really like what has even pushed me forward. I didn't even need any reassurance, but somehow I just want to be a pharmacist even more.
We're the most accessible healthcare providers, and we really advocate to our students that they want to help their patients prevent problems as opposed to reacting to those problems. So that's one of the dynamic things that we do here at the college, is really encourage students to be proactive.
So our goal at MCPHS is to train pharmacy students to be leaders in the future and to really bring their knowledge and expertise and to lead the changes within the profession of pharmacy.
I would say MCPHS is great for anyone who absolutely has a passion or just is interested at all in maths, sciences, the human body, how it works, interacting with other healthcare professionals, communicating in a way that you're going to help another person.
My experience at MCPHS has really been one of the most wonderful experiences of my life, because I've been challenged, which is actually something I enjoy. I was glad that I wasn't bored in my classes. I was learning constantly.
When I graduate, I'll probably feel that even more of excitement, wow, I can't believe I've done this. This is exciting. All this hard work has paid off.
I'm so excited about my future. I have a year and a half left here at this institution to grow as a professional, and then sky's the limit.
We'd love to see you here at MCPHS in our pharmacy program. Utilize those skills, your talent, and bring it here to the college, and we'll make sure you're successful in the long run.